Take a look at this post on your screen there, coming from the Washington Post, saying a Kenyan court suspended a Trump administration plan to establish a makeshift field hospital in Kenya to quarantine and treat Americans exposed to or infected with Ebola. That ruling came the day the U.S. officials said the facility would begin operating, which was set for today. Fox News correspondent Garrett Tenney has more.
Enhanced border screenings across Central Africa as an Ebola outbreak in the Democratic Republic of Congo intensifies. Now, a court in Kenya has temporarily suspended the Trump administration's plans to open a quarantine facility in that country for Americans exposed to the virus. The 50-bed center was scheduled to open on Friday, but faced legal challenges over cross-border infection risk.
There had been no transparency around impact assessments, around contingency measures, around the procedure by which this was approved.
It comes one day after Kenya's government provided written approval for the site as part of a coordinated public health response with the U.S. that Secretary of State Marco Rubio says includes more than $13 million for the East African country's Ebola preparedness efforts.
The State Department and other agencies represented here, the Centers for Disease Control, HHS, others, are working very, very hard to contain this crisis to the countries where it's currently located.
So far, Kenya has not recorded any Ebola cases, but in Congo, the World Health Organization says the outbreak is growing faster than the response efforts can handle.
Kenya has officially blocked the United States of America. Now, you may say, what exactly does that mean? Well, as you can tell by the videos that are circulating online, the Kenyan citizens are not happy to hear that the United States of America, under President Donald Trump, wants to launch an Ebola facility. The Generation Z right now in Kenya is like, no, how about instead, America, you launch an Ebola facility and ship everybody there? Why do you want to ship everybody to Kenya? Now, the United States is like, look, you're in East Africa. This is taking place in the Congo, Uganda. These guys are your neighbors. So you should just launch the facility, bring all the sick people to Kenya. And then, of course, it would spread throughout Kenya. So the Kenyans are like, no, I'm not feeling this. This is not a good idea, okay? If you have not heard about this story, you need to be looking on TikTok. You need to be looking at the world news channels because even BBC is talking about it, okay?
Yeah, and I know the videos that I've seen, a lot of Kenyans was like, hey, why, if this does happen, which I believe they blocked it or whatever, but why is it only Americans? So even if there is Africans that has Ebola, they cannot go into this facility, I guess you would say. So this is just something a little bit different and kind of the same. So for me, it's just all about, you know, they try to do these things to try to block people from coming to Kenya. You know, they try to put fear. They try to say, hey, Ebola is here, Ebola is there. You might not want to go there. You know, that happened in 2020 when they was, you know, blocking a lot of countries saying like COVID's there, COVID's here, but it was only a couple countries open. So I guess for me, it's just more of you got to be on the ground to really know what's truly going on in a country that they're talking about.
I don't know, you know, because COVID-19 was airborne. It was flu-like. But this Ebola, guys, this is a hemorrhagic fever. If you know what hemorrhage means, that means you're having internal bleeding. This stuff is dangerous. So you may want to maneuver and be wise about which countries that you are going to. But nonetheless, Kenya's like, no. Don't send these sick people over here. Y'all need to have that facility over there, especially you guys in the United States. You say you're the best country on earth. Why would you want to bring it to a quote unquote third world country, right? If you're the best country. And listen to what the BBC says. Their article literally says Kenya court halts opening the U.S. Ebola quarantine facility in the country, okay? So they wanted to house these people in Kenya and quarantine them. A Kenyan court has suspended U.S. plans to open an Ebola quarantine facility for American citizens in that country that has sparked public concern about cross-border infection risks. Now, this goes to what you were saying about them being sick Americans. These are not even Kenyans. They want to ship the sick Ebola-infused Americans from the United States over to Kenya, okay? Now, these people could have been working in the Congo, but they're saying, we don't want you to return home to America. You need to stay out there in Africa. Y'all keep that on that continent. We don't want it over here in America. We already got the hantavirus. That is too much. We don't want to deal with all that.
Yeah, they might as well just ship them to Nevada with the
cruise ship,
yeah, the
ship
cruise
them on
ship
the cruise
people.
ship,
Yeah,
ship them to Nevada. They got
right.
the quarantine facility. They said no, that quarantine facility is specifically for
Only for
Hanta.
this Hanta.
You know, they're having a niche. They're like, look, this is the Hanta
This makes me
quarantine.
laugh.
Y'all got to go somewhere else with all
Yeah.
of that. Now, the 50-bed isolation center is to be staffed by U.S. medics. Okay, so United States doctors, nurses, emergency people would be coming in, and was due to begin operations on Friday, according to an American official. This was literally published 2 days ago.
Mm.
But the Kenyan government has not officially commented on the plan. Now, this is showing you William Ruto probably is like split 50-50, because America thought they could come in, but William Ruto is like, okay, my people aren't feeling this. Maybe this really isn't a good idea, you know? They do say, oh, he's a sellout, all this, but he's like, maybe I shouldn't go to that extent. Maybe this could get really bad. In its court petition, the rights group, the Katiba Institute, warned that the arrangement posed grave and imminent risks to public health, and I would have to agree. A high court judge barred the operation of any Ebola facility in Kenya. Shout out to their high courts, their public health people. They are doing what they need to do. They're not willing to take money for this. There's a lot of things that they wanted to jumpstart in Kenya that a lot of the citizens and high courts have revolted against, both professionally and taking to the street saying, no, we're not actually going to allow this in our country. This is literally why we break down Kenya as being one of the places in the state of the diaspora. And I think if you are listening to this video, you may want to check the link in the description, because we have the 5-in-1 State of the Diaspora occurring on June 7th. Okay. You want to be in that room, but there are only 5 slots available because 2 people have already taken them up. Your ticket is available for $105. We go over the 5 to 7 best countries for you to travel to and move to in Africa, because all countries are not equal in Africa. You have corruption, you have bribes, you have indecency, you have a lack of sanitation, you have financial issues, you have residencies that aren't really all equal. Some are 1 year, 2 years, some are 5 and 10 years, renewable for up to 10 and 20 years. Okay, so you got to think about these things. Link in the description to get your ticket and be in the room with other expats, retirees, and diaspora travelers. Now, the exact location for the U.S. treatment center was not disclosed by American authorities, but lawmakers from Laikipia County, central Kenya, have raised objections after reports emerged that it would be established in their area. If you are Kenyan and you are in this area, please comment down below. Let us know what you think. Also, comment down below if you have Congolese friends, Ugandan friends, people that have actually had Ebola and survived, or if they had a family member that had it, so that the community here on Journey with Us knows what to look out for. We have people watching from all over the world. People want to understand what's happening, okay? Now, MPs on the government called on this to be clear about the details, saying they saw no logic for Kenya, especially or Laikipia, hosting the medical facility. County Governor Joshua Arungu has also opposed the plan. Now, the satellite imagery of an airbase in Laikipia shows that an area just over the size of 3 football pitches had been cleared at some point between Monday and Friday.
Yeah.
That's fast. They cleared 3 football fields between Monday and Friday of last week to potentially quickly build a medical facility. Can somebody say Bill Gates is probably behind this? Now, the U.S. Isolation Center is intended to treat U.S. citizens believed to have been exposed to the virus in the Democratic Republic of the Congo and Uganda. If you want to read more on that, visit thebc.com. It's just out there. It's not secret news. It's very much in the front news page so that you can read it and review it and see what you think about that, because that's kind of crazy. And that's why this is an expat alert. This is something that expats need to be aware of.
Yeah, I would say, yeah, it just kind of reminds me of 2020, to be honest. You know, they try to spread. I'm not saying this is not real. I'm saying it's real, but it's just up to you on how you're going to accept it. Like, you can't let fear move you. You get what I'm saying? So this is why we do the things that we do, to let you guys know which countries are the best, which countries will take care of their citizens and even people that's coming into the country. Because for me, it's like, man, they're trying to stop people from, because if you do the research, a lot of Americans go to Kenya. You get what I'm saying?
True.
So they're trying to stop that as much as they can. A lot of Americans are starting to realize they probably need to come to Africa, right? As you guys see, we are getting sun kissed right now. It's a blessing to have this sun, and it's a healing, right? So for me, I'm looking at the bigger picture of they're trying to make up stories and stuff so people will be fearful from traveling. Because trust me, we still know people that's traveling. They are moving. They are not stopping. You get what I'm saying? But they could put that in your face like, oh, people are not going there because of this. People are not going to Rwanda because of this. No, people are still doing it. And that's why I always tell people like you can't let fear control you.
Right, because there are 54 separate countries in Africa. Everywhere is different. Just because something's affecting Congo and Uganda does not mean that you can't come to Mauritius, Namibia, Botswana, Kenya. But like you said, this actually seems like they're trying to transfer it, because why would a country that's not currently experiencing Ebola, why would you expose them? This actually goes against everything sanitation, public health. Why would you expose them to it in Kenya? Wouldn't it make more sense to open the medical facility in the Congo and maybe Kinshasa, or in a different region if you want to do a remote region? Congo is a very big country where you can do it in different areas, or Kampala, Uganda. Wouldn't that make a little bit more sense instead of having to ship these people over to somewhere in Kenya when Kenyans aren't really affected? It seems like they may be trying to spread this, but we want to know what you think.
Exactly.
Check out the links in the description, because this is wild. Don't let this deter your plans, but also make sure that you are choosing the right country in Africa. Make sure you have some foresight, because it just doesn't hurt to, have a 10-year retirement visa, a multiple year digital nomad visa in a country like Mauritius, where you can actually change it in country to a self-employed entrepreneur for 10 years. You have all these different things available to you in countries like Mauritius, Seychelles, a Namibia, a Botswana. There are options out there, and you deserve optionality. We'll see you in the next video. Shalom, shalom.
Shalom, family.